The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
And this kind of dovetails into our topic today, which is what goes into a prescription for ABA. And maybe we need to backtrack just a little bit. I want to make sure everybody knows ABA, Applied Behavior Analysis, considered the gold standard of treatment for autism and has been since the 80s. And that everybody that's in the United States now, pretty much everybody in the United States, there are mandates in every state that behavioral health needs to be covered in your insurance plan. So almost everybody has the ability to access funding for ABA. I got to pick my words because not everybody has the ability to access the actual treatment. There are waiting lists.
Right.
But certainly for a lot of people, if a diagnosis of autism happens, there is a prescription that is given for a specific number of hours for ABA. There's a whole lot of misunderstanding around this prescription. And I can't think of anyone who would be better to address what this is, what it means, what goes into it than you.
That's awesome. Yeah, and I like talking about this. So, the way that the whole thing starts is that as an ABA provider, you're supposed to do a pretty comprehensive evaluation of the individual and determine their needs, right? Because every child is different and in lots of different ways, different in a lot of ways, different in their needs. That's one. Different in their age. That's an important factor because as you get older, more and more things are expected of you in society, through school, through life, etc. And different in obviously these medical issues and other surrounding issues that influence how you learn, right? So we really do need to do an assessment when you begin. And that assessment produces a picture of the child. And that picture tells us lots of different things. One is, first of all, it starts with what does the family want for this individual, right? What are the goals? Based on, some parents will say, oh, I want to do as much as I can right now because I really want my child to stop doing these various behaviors, challenging behaviors, and I want them to communicate, go to school, blah, 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 like lots and lots of things, right? So it's a whole big set of goals. Other families will say, honestly, I don't really want my child to change all that much, but these specific behaviors are very difficult to manage and we need help with these things. So there's a selectivity that occurs right at the beginning based on the parents' goals, right? So that's number one. Secondly, when you do these evaluations, you identify the child's strengths and areas of weakness. And this is very important because you look at the symptoms of autism, and the symptoms of autism are basically a series of observable behaviors that tend to detract or take away from the child's ability to succeed in society. And I'm going to say that again. The symptoms of autism, they are classified together as autism, which is a disorder. Why? Because when all of these symptoms exist, it makes it very difficult for the individual to do well in society. So as an example, some of the symptoms are, delays or lack of communication. So either communication doesn't even exist verbally or there are significant delays. So just think about that one alone, right? On how if you are unable to communicate with others, how it can affect your ability to have a healthy life. You're not able to communicate your needs. You're not able to understand what others expect of you. You are not able to interact with others. So it causes isolation. It can cause a lot of frustration. It can cause the appearance of challenging behaviors because you can't communicate your needs. So just that one symptom alone can have very significant repercussions, right? And there are other similar symptoms, sensory symptoms, stereotypy, the inability to have social interaction. There's a lot of autism symptoms as a whole make life more difficult for the individual. So basically what you do in the initial assessment or evaluation is we list areas that are affected that should be altered if we want this individual to be able to join society and thrive. Again, one example is, okay, this person doesn't communicate. I need to teach them communication. Now, the fact that they don't communicate has also led to certain challenging behaviors. So I also need to get rid of those challenging behaviors and teach this individual that the more they communicate in an appropriate way, in an adaptive way, and the less they communicate through challenging behavior, the more they're going to interact with others, the more they're going to be accepted in society, the more they're going to succeed, thrive, etc. So all of the areas of weakness or the symptoms of autism, right? And you break it down a little bit further. For example, the person doesn't vocalize, communicate, right? The person also doesn't give any eye contact whatsoever. So you miss a lot of information when you don't look at people, when you don't give them eye contact. So that might be an area that we want to work on. The presence of stereotypical behaviors like lining up objects or, finger flicking or hand gazing or just gazing corner of the eye, those types of things. They might not be significantly problematic on their own, but they certainly remove the individual from what's going on around them. Do we want to address some of those and make sure that the individual is a little bit more aware, a little bit more present, and not engaging in those stereotypical behaviors, for example? And there's sensory issues. You want to pay attention to those and say, okay, this individual has a lot of sensory needs. They really engage a lot of time in, putting things like certain textures on their hands and so on. Are we okay to leave those alone, or are they distracting from the individual's attention and ability to learn, right? So those types of things. And then as you go through and you basically list all the different areas, one very significant one that often gets ignored, but is very common in people with autism, is the perspective taking or theory of mind deficits, where a lot of individuals on the spectrum have a difficulty or even inability to see things from someone else's perspective. And when you're unable to see things from someone else's perspective, believe me, that impacts a ton of things. It impacts your ability to understand other people. It impacts your ability to understand social situations, to understand jokes, to understand deception. There's a lot of things that are impacted just by that one area of delay. So basically, you do a very full comprehensive evaluation. You identify a series of behaviors that are deficient, right? They're not occurring at the level of a typically developing individual of the same age. And then you also identify certain things that might be excessive. For example, all of the challenging behaviors that we see in our kids, which are not specific symptoms of autism, but they are side effects due to the frustration the individual experiences. So because they cannot express themselves vocally, for instance, they might hit or they might run away when they're frustrated, those types of things. So all of those challenging behaviors are listed. And then the concept of ABA is, hey, I'm going to try to reduce these challenging behaviors because I'm going to teach the individual more adaptive ways to communicate, more adaptive ways to calm themselves. And at the same time, I'm also going to really teach skills that will allow the individual to be able to express themselves, that will allow them to be able to interact with others and interact with society, and kind of like bring their behaviors closer to the behaviors that are expected in society, right? So teaching a lot of new skills and also not accepting some of those bad habits that have formed. And so that's the core of ABA. Now the question becomes, how much of that do I want to do? That has a lot to do with the severity, how severe are the symptoms of autism in this particular individual? What is their age, and what are the overall goals? And so let me give a few examples of that. So if you have, let's say, a child who is 2 years old or 3 years old, and we've just started to identify some of these issues, right? The child has some basic vocalization, hasn't developed a lot of language. Their language is delayed, but it still exists to some extent. For instance, they might vocalize the basic needs, but they're pretty isolated the rest of the time because they're not understanding very advanced language, for example. But they haven't developed a lot of challenging behaviors, maybe a few, like with their sibling or peers, they might tantrum when a demand is placed or when they don't know how to express they want an object, those types of things. That individual is definitely is the type of person who has a lot of potential because the symptoms of autism have not affected them yet significantly. So, and they're young enough where there's a lot of time, right? And when I say well, there's a lot of time, because remember, when the person turns 5, 6, etc., there are additional demands, right? There's school now. We also have to deal with academics and all these other things. But when the individual is 2 or 3, we have plenty of time to teach. We have a lot of available time. So what do? In that case, we set very high goals because we have time to teach those things. The individual is young and they're not affected severely by the symptoms. So we have the highest goals we have at this point is like, I'm going to teach this person everything they need so that by the time they're 6 or 7, they're indistinguishable. They can go into society and not have to receive special education or additional tutoring. They can be mainstreamed, integrated into regular education, and hopefully they will just go on and their behaviors will be fantastic and they'll be able to interact with others and so on and so forth. So with that individual, we're going to recommend a very intensive, what we call early intensive behavioral intervention, EIBI. And that is appropriate for younger children who have time and are not significantly affected because we think that in that period of time, let's say 3 years, if we do very intensive work, we can actually catch them up. We can catch them up to peers of the same chronological age. And that's why we do these 40-hour programs for younger children. These are EIBI programs, and that's why it's funded, because the belief is that if we do a lot of intensive work right now, this individual is not going to need support for the rest of their life.
Yeah.
Okay, then now let's go on to, let's say, a 6-year-old child who is what we call a level 2-2. So they have some language delays, some stereotypical types of behaviors or sensory types of behaviors, but they still have a lot of potential because they are learning very rapidly. They are paying attention. Let's say at this point, there are other issues, whether it's sleep, medical, dietary, all of those types of things have come under control. So what are we going to do with this individual now? Well, the individual is already in school. So, they might be receiving some form of support in school, but the bigger issue is that they're in school for 30 hours a week. So their time is limited, right? The amount of time we now have with the 6 or 7-year-old is maybe limited to 20, 25 hours a week of one-to-one intervention time. So let's say they get out of school, right? So we can actually do ABA with them every day from, let's say, 3 to 7 p.m., and we can do some on the weekends. So we can get in about 25 hours. That's great, because in 25 hours, we have the ability to teach this person so many of the skills that they might be lacking. We can help them understand so many of the issues that are holding them back. And definitely we can teach them new behavior patterns so that, they're learning how to make friends, they're learning how to learn better in school, they're able to regulate their own sensory needs, their own challenging behaviors. And so for a child like that, we might be doing something like 25 hours a week of ABA. In the old days, Shannon, we were able to do 25 hours with that individual, as well as give them a lot of support in school. So another 10 or 15 hours of one-to-one support in school. It has become harder and harder to do that, as schools don't really allow providers in school all that often. They have their own one-to-one aides, and it's a whole nother kind of can of worms to open. But if we are able to give the individual 25 plus hours of quality ABA, that is the ideal type of prescription for that type of individual. Now, as the person ages, let's say now we're talking about a 10-year-old, and there are some significant delays at this point. Okay, we still do an assessment of all of their needs, but then we ask ourselves, realistically, what are the most important areas that we want to focus on? Because not only is there limited time, because obviously they're in school until 3 o'clock or so, but there's going to be limited resources too. Because as you age, what happens is payers, insurance companies tend to feel like, okay, we need to focus because we're not going to be doing intensive programs for the rest of your life. We really need to focus on the things that are the most important to your condition right now. A lot of times when I'm working with, let's say, 9, 10, 11, 12-year-olds, the issues have to surround mainly challenging behavior. I mean, there's obviously 9 different severity levels of kids with autism, but let's say typical child, by this point, a lot of their frustration, right? They're frustrated because when they were younger, they didn't learn a lot of language and communication and subtle, the eye contact, which allows you to read facial expressions, and they didn't learn theory of mind or perspective taking. So they don't understand when other people are their friends or they're making fun of them. There's frustration, and they might have lots of sensory issues that have become ingrained now. So the individual tends to have more frustration. They have a harder time merging with society. And so now with this individual, I'm focused on the things that are the most important. Is this someone where I have to focus on safety because they're running away from home? Is this that becomes a priority for me, as opposed to, let's say, teaching them academics or teaching them, how to, do chores at home. Those things are important too, but safety takes priority. Communication instead of challenging behavior takes priority. So we now have to prioritize the things that we want to work on. And again, we have to hope that the payers, the insurance companies, are willing to pay for, let's say, 15 hours a week, 3 hours a day, to allow us to teach those things. And, although there are plenty of research articles showing that ABA continues to work until adulthood, there are not, unfortunately, a lot of research studies that show that you can actually catch up completely with all the skills that you need if you start later and if you don't do intensive when you're younger. So, our insurance companies unfortunately use that, and because of that, it's very, very unlikely that they will pay for a 25, 35, 40-hour program a week. And so we are left with fewer hours, and with those hours, we really have to prioritize. The prescription really, just to summarize, has to do with what are the needs, how much time do I have, because Because remember, our prescription with ABA is not a pill that you take, it's hours. It's hours. And so how many hours can I actually realistically provide this individual? And given those hours, what are my priorities?